Your back pain is not going to improve if you don't take time to address the hip mobility issues. One thing that I commonly see with people when they're having back pain is that they have a lot of trouble moving their hips and moving the muscles that connect to their hips, to their pelvis, and to their back. And this is simply because of inactivity, disuse, and honestly, we're not taking the time that we need to take on a daily basis to actually stretch. And I'm guilty of that as well. So, we're going to go through just some different things that you can do to address hip mobility, the importance of hip mobility, and also show you some easy stretches that you can incorporate within your number routine. So that way you're not having the back pain. Because if your hips are tight and you're not moving well, your back is going to be hurting. So let's go ahead and talk about that a little bit more. So, first, whenever I say hip mobility, everyone always wants to jump on YouTube or TikTok and try to find out what stretch they can work themselves into. And that's great. But sometimes the information that you find is not that helpful because you realize you're not that flexible. So you don't have to try to start off trying to be the next gymnast or acrobatic star, but you can simply start off with some basic things to just get your hips moving. One motion that I like to check a lot is whether or not someone's able to actually lift their foot when they're sitting down to place their foot on top of the opposite knee. And I'm going to show you that later because that gives you some information as to whether or not your piriformis muscle is tight and also can give you information as to how tight your low back is as well. Now, if your hips are tight and the piriformis muscle I just mentioned is tight, that's going to cause you to be positioned more so with your feet turned out and even rotating your feet out as your knees out as well when you're walking and standing because those muscles are known to help externally rotate the hips, meaning bring the hip bones out. But if they're tight, they're going to get stuck there. And if they get stuck there, you're not going to have good movement at the hips, which can impact how your back functions as well. Other muscles that get tight are your hamstrings. And if you think about how much time we spend sitting on a daily basis, then you'll understand how tight and how easy it is for our hamstrings to become tight. Because when you're seated, your pelvis is this portion right through here. When you're seated, it actually kind of rotates underneath you this way. But when that happens, it shortens out your hamstring muscles back here. So you want to be careful and mindful that you're taking the time to stretch. And even if you work a job where you have to spend a lot of time sitting, I'll show you a stretch that you can do while you're seated and also show you one that you can do on the ground as well. Just so that way you can make sure that you're addressing the hip mobility and the hamstring flexibility. So you heard me mention the piriformis, you heard me mention the hamstring. The last muscle group I want to mention are your hip flexors because they do the opposite of what I told you the hamstrings do on the pelvis. Your hip flexors are actually going to cause for your pelvis to rotate this way here and be more anteriorly rotated. But that can cause more stress on the back as well. So reason why that can cause more stress is because it's going to cause your lumbar spine, your lower back to be more extended. But if you pair that rotation of the tightness, sorry, of the hip flexors, if you pair that with tightness of the hamstring, then you actually can have someone who has a spine that's not moving at all because the pelvis, the muscles surrounding the pelvis don't extend and don't lengthen. So you need to make sure that you're stretching out those muscles. So once again, quick review of the muscles that we talked about. We talked about your piriformis muscles, which are the outside of the hips, which help to rotate the hips outward into that external rotation. We talked about your hamstring muscles, which connect to the back of the thighs and at the buttock, at the base of your pelvis. And we also talked about your hip flexors. Those are the muscles on the front of your pelvis. Those are the three main muscle groups we're going to kind of target right now when it comes to hip mobility, because those are the ones that are most commonly impacted with individuals who have back pain. So now that we talked about muscles that can cause back pain and a little bit about how those muscles can cause back pain, let's talk about the most important part, what you can do to fix that pain. So you already know the whole purpose of this is to get you moving and so that way your hips can be looser and have mobility. So we're going to go over just some basic mobility things that you can do and also some easy stretches that you can incorporate in your normal routine so that way you are able to work on your hip mobility because remember, movement is medicine. You want to make sure that you are moving. And if you're not, those muscles become tight, especially at the hips and pelvis, your back is going to hurt. So you want to make sure that you're taking time to address this before you get to that point But if you're already at that point, don't worry, it's not too late because you can begin incorporating these things into your routine and help mitigate some of those symptoms. So, first thing I'm going to have you do is I'm going to have you take a seat in a chair if you want to join. So, I'm going to move to this chair back here. Actually, I'm going to move the chair up a little bit. All right. So, with our chair right here, first thing I want you to do is we're going to stretch out our piriformis. So our piriformis muscles are going to be on the outside of our hip. They're going to come through here. And remember, I told you those piriformis muscles, they're important for helping to turn the hips out. Okay, so if the muscles on the outside of the hips get tight, then you're going to more so be positioned this way here. So what you want to do in order to stretch this, first you can actually test and see where you are. I want you to see, are you able to pick one leg up and lift that foot on top of the other leg? Now, did you have to use your hands? Because if you have to use your hands, that's letting you know that there's some mobility and strength issues. And it's okay if you need to use your hands. Just think about how much effort you put into it, especially if you're using your hands and you're having to lean back to do it. That's letting you know that we have some muscular and mobility restrictions. So first thing, just get the foot on top, just as we did. And now I want you, if this is already a stretch, I just want you to hold this position. If your knee is higher up or closer to your chest, you want to gently try to push it down. Now, the key with stretching is that you're stretching to your tolerance, okay? That is the key. You want to stretch to your tolerance. So you should not have any numbness or tingling. You should not have any extreme discomfort, but a stretch is going to be a little uncomfortable, especially if you're very tight. Now, as we're stretching and holding this position, we know that we can hold it for at least 30 seconds, and then we can switch over to the opposite leg. So for the time frame that I've been talking, that's been about 30 seconds. So now we'll give that leg a break. If you need to use your arms to bring it down, that's perfectly fine. Go ahead and do that. Now I want you to test out the other side and see, are you able to lift that leg up on top of lift that foot up on top of the opposite leg? If you need to use your hands, go ahead and do so. Now, as you lift that leg up, something else I want you to take note of is, do you feel your body slouching down like you're kind of slumping through your tummy and through your torso? If so, that's the indication that you're lacking flexibility and also have mobility restrictions, okay? So just be mindful as you're doing this stretch, and if you're able to gently push the knee down, go do that. Push the knee down to your tolerance. Otherwise, focus on sitting up nice and tall. Now, if you're someone who has a little bit more flexibility, you can also add in the forward leaning position here. But even as you're leaning, you don't want to start slouching and rolling forward. You want to try to keep the spine straight and lean forward, still stretching to your tolerance. The good thing with this type of piriformis stretch is that this is something that you can do while you're seated at your desk, okay? So this one, you don't have to get up and move. You can do this one while you're already doing a seated-based activity, especially those who may work with sitting for long periods of time or even working from home. So we did each side once. Let's go ahead and do each side again. So that way now you can pay better attention to what your mechanics and how your posture is, because you want to make sure that you're not slouching and rounding forward. You want to try to keep the body upright, and you also want to gradually lean in if you're able, or gradually push that knee down. So first, go ahead and bring one leg up. Compare to the very first time you did it and see, was it easier bringing the leg up that time? If not, it's okay. It does get easier the more that you do it. Now, if you're able to gently push that knee down, we don't want you slouching back, so try to stay up nice and tall. If you're still not feeling a stretch, go ahead and lean forward. So that way now you can increase that stretch to your tolerance, okay? Increasing it to your tolerance. If the knee is still up here, you're just going to focus on gently pushing that knee down while you maintain a good posture. As you are stretching, don't hold your breath. You want to make sure that you are breathing. Sometimes counting out loud can help you better breathe and also ensure that you're not holding your breath. So don't be afraid to count. All right, let's go ahead and switch back over to the opposite side now. So same thing, comparing what you just did. You're going to lift the leg up. If you need to use your arms to lift the leg up, go ahead. Otherwise, bring the leg up. If you're able to bring that knee down, gently push the knee down. If not, use your hand to gently push down just until you feel a stretch on the outside of your hip here, okay? Now I'm going to have you, if you're able, if you're already feeling a stretch here, stop there. Otherwise, if you have a bit more flexibility, go ahead and lean forward. But either way, focus on your posture. We don't want you rotating that pelvis backwards. We want you to try to keep the pelvis in a neutral position, more upright, even if you're leaning forward. And breathing in through your nose and out through your mouth. Good. So that one is for your piriformis muscles on the outside of the hips. Remember, those muscles are important because they help to externally rotate our hips. But if our hips become too tight, those muscles won't have as much flexibility. And you may not know this, but your sciatic nerve runs in close proximity with that piriformis muscle. So you want to make sure that you are stretching that muscle because that also can decrease sciatic nerve irritation and pain. Another stretches you can do to try to help with mobility at the hips and at the back is a hamstring stretch. So when you're doing the hamstring stretch, especially if you're someone who has to sit down for work, you can easily do it while you're seated, bringing the knees straight, keeping the back straight. You don't want to arch and roll the back. So keeping the back straight, not hunching and rolling this way, but straightening out that leg and gently leaning forward as if you're going to touch your toes. If you can't touch your toes, that's okay. The goal is to feel a stretch in the back of the thigh. If that's too intense, you can also use a step underneath your foot to lift your foot up a little bit. And that way now you can lean forward. So just as with this stretch as with before, you're going to stretch to your tolerance. A stretch itself should not cause like a lot of numbness or tingling. You should not have intense pain. So you're stretching to your tolerance. As you're holding the stretch, breathe. You're going to continue to hear me to tell you to breathe because you want to make sure that you are staying relaxed as you're stretching. With this, just as we did with the piriformis stretch, your hamstring stretch, you're going to do on both sides. That's going to be very important. So that way, one, you can work on symmetry, but also so that way you can notice if you have tightness on one side more so compared to the other side, which is not an uncommon thing. So now on the other side, same thing. You got to keep the back nice and straight. Bring the foot down in front of you, and you're just going to lean forward. Remember, you don't want to roll your back or arch because that's going to change the position of the pelvis, and that's going to decrease the stretch a bit at this hamstring. We want you to go for the best stretch that you can. And just holding for about 30 seconds, just as we did before, continuing to breathe, and only stretching to a point where you feel comfortable. Good. So with the hamstring stretch, you heard me mention earlier that when you're seated, in this position here, this is how we want you to typically be. But if your hamstrings are tight, it's going to rotate your pelvis backwards, and that's going to cause flattening of the back. So it's going to cause you to go from here to here if your hamstrings are tight. And it's not uncommon to see when individuals are seated for a long period of time, so make sure you're taking time to stretch your hamstrings. Now, with this next one, we are going to go down to the ground. Well, not down to the ground, I should say more so in a standing position with this next one, okay? So let me move this chair. All right, so next thing that we are going to do is we're going to go to a partial kneel here at the wall. So just like in a lunge position, you're going to use the wall for balance because we're going to stretch out the front of your hip. The front of your hip, these are your hip flexors, and these muscles here can get tight and they can cause you to arch your back because your pelvis is rotated forward. So with this one, what you're going to do is you're just going to bring one leg forward, one leg back. The leg that is back, you're going to gently push your hips forward using those muscles until you feel a stretch on the front of that hip. And as you're holding this here, I just want you just to breathe. Remember, you can use the wall for balance. And depending on how tight you are, that's going to determine how much mobility you have. Because some people will stop up here. Others will be able to go down for a much deeper stretch, okay? So you're stretching to your tolerance. And then we're going to switch over to the other side. So using the wall for balance and stretching for your tolerance, okay? Making sure that you're breathing. And same thing as we mentioned before, try not to slouch. Try to stay upright as you're doing this. But with this one as well, you also don't want to overextend through the back. You want to just keep the spine upright in a nice neutral position, okay? So holding this position here. Good. And then relaxing. So that stretch will be good for your hip flexors. So we've done the piriformis, we've done the hamstrings, and we've done a stretch for your hip flexors. Now let's just talk about general hip mobility. So when you are seated, you can do this one in a chair as well, but you will not have as much movement, which is okay. It just depends on where you're starting out mobility-wise. But when you're seated, you can just gently work on bringing one leg further out to the side, back up, and then bringing that leg in and back up. And then switching over to the other side, bringing the leg out to the side, back up, and then in and back up. Now, if you're noticing any pinching sensations at all with this, I want you to go ahead first and decrease the amount of bend that you have at your hips. By that, I mean you may want to bring the angle down a little bit, so that way you're not getting as much flexion at the hips if you're noticing any pinching, okay? So we do not want pinching pains with this, but just bringing the leg down, back up, and then going on the inside and back up. And same thing, going down the small way inward and back up, and then going back to the outside. Good. If that's one that you can do that's not causing pain, continue to do that. Otherwise, I encourage you to gradually work up to a motion that you're comfortable with. So it doesn't have to be the same amount of range that I had. It doesn't have to be anything that you compare to how much range someone else has. So just be mindful that how much movement you have is going to be individualized, okay? So now the next thing I want you to do is I'm going to have you bring one leg down in front this way. The other leg is going to come just behind you like this. So if getting to this point is a stretch, what I want you to do is gently ease off. And what you can do to ease off is turn your body towards the leg that is in front a little bit and rock forward. That will take some of the pressure off that back hip and also the front. And if this is already a stretch for you, then that's going to be your starting point. Just being able to tolerate coming upright in this position and then going back down and going upright and going back down. Good. But if you're getting to this position without any pain, without any difficulty at all, then the next thing that you can do from here is you can gently bring that front leg forward a bit, keep the back leg where it is, and then gently reach with your hand towards that opposite side and gently turn your torso. So you feel that stretch on that leg that is slightly back. Take a few deep breaths and then relax out. Good. And now gently turn back towards that again. And what we are doing is we are actually stretching that back leg into hip internal rotation. Remember I told you the hips typically make it stuck in external rotation. So this is stretching that back leg into hip internal rotation and back down. Good. And we're going to do one more time going that way. So gently coming back, just working on that hip mobility. Because if our hips are moving well, then our back will not hurt as much, and then we can work towards eradicating the back pain altogether. Good. Awesome. So we've done this side here. Remember, I told you symmetry can be important when it comes to muscular imbalances with both strength and mobility with flexibility. So now we're going to do the opposite, okay? So now I'm going to have you bring the leg that was in back. I'm going to have you flip that leg around. So now you're going to bring that leg in front, and this leg is going to go behind you as such. Just as I said before, if getting to this position is already a stretch and you already feel some tension here, this is where I want you to stop with this stretch. And you can lean forward to ease off a little bit, even if you need to bring that front leg out a little bit. So you can lean forward to ease off of this back leg a little bit. And then you can come back up and just try to hold that upright position. And this here will be the beginning of your stretch for internal rotation of that back leg. And then gently relaxing off that back leg a bit. Good. And then coming back up. So just moving in and out of that to work on your hip mobility so that way we can decrease the stiffness, decrease the flexibility restrictions, and improve the mechanics at your back, decreasing the back pain. But if that what we just did is not enough stretch for you, then I want you to progress it to the next one. And you're just going to gently turn your body towards that leg that is in front. And as you turn, you're just going to gently try to push this hip forward, and you should feel a stretch. We're stretching that side into hip internal rotation and just taking a few deep breaths. We're also getting some spinal rotation, which is wonderful when it comes to regaining mobility at the hips and flexibility at the spine. Good. And relax. Because movement is medicine. When you're moving, one, you're improving the circulation to an area, but you're also helping the joints as well to get the movement that they need. So sometimes with certain joints, what we actually need to have, they need to be stressed just a bit. So that way they can actually have the nutrition the joint needs move back into the joint and also move some of the waste products out of the joint as well. We're going to do that same mobility drill just again. So now turning your body towards that front leg and gently using the muscles to push the hips forward and just taking a few deep breaths. Good. Very good. All right. So when we were seated in the chair before, I showed you how to do a stretch for your piriformis while you were seated. If you're on the ground with me, I'm also going to show you how you can do a stretch on the ground for your piriformis, and then some more stretches that we did for the hamstring and also your hip flexor. So that way you will have variety. Remember, the chair stretches we did before are good for individuals who are not able to get on and off the ground. Or also, if you're just working and I understand that you can't get up out of your chair, you can still stick with the chair stretches while you are working in the seated position. But now let's show you a piriformis stretch that you can do while you are on the ground. So one version that you can do is when you're seated, and if you have the mobility, you can bring one leg up and cross the ankle on the opposite knee. And now you can gently use your body to gently pull that leg towards you so you're upright. So to a position that is comfortable for you, okay? Comfortable for you. But if that's too much strain and too much stretch, then I want you to ease off of that altogether. And then I want you to roll onto your back. And with you here on your back, you can cross one leg on top. And now you can either use your hands or a strap behind the thigh. And you can gently pull that thigh towards you. And you will feel that stretch on the side where you have the foot up. So you're going to feel it in that buttock region on the side where the foot is up. And that is to stretch your piriformis muscle. So that way we can work on decreasing the tension at that muscle, improving your hip mobility, and ultimately decreasing your back pain. Good. And then you're going to bring that leg down. And we're going to repeat on the opposite side. Remember symmetry. Symmetry is important. So bringing that leg up. If you're able to drop that knee down when you bring it up. So first my knee's up here. And now dropping my knee down if you're able to. And then using a strap with your hands to grab behind the thigh that is for the foot still on the ground. And pulling that leg towards you. And same thing, a few deep breaths. Making sure that you're breathing. Good. And if you're someone who wants to hold your breath, don't be afraid to count out loud. It can be really helpful so that way you're not holding your breath. Very good. And then bringing both legs down. And what you can do after that stretch to work on spinal rotation and also hip mobility is just gently rocking the knees side to side to a point that is comfortable for you. So don't feel like you have to try to touch the ground, because we want you to just go with the motion that's comfortable, where you don't feel tension, when you're not straining. And this will help with spinal rotation. This will also help with the hip mobility that we are looking to regain to help with back pain. Good. We'll do one more time over here. Good. So that was for our piriformis, and then we added in some spinal rotations. Now let's do for our hamstring, because there are different ways that you can do for the hamstring. But since you're already here lying down on the ground, let's stick with this position. So I'm going to have you grab the back of the thigh, and then I'm going to have you gently pull the thigh towards you, and then try to kick the foot straight. Now, if you are someone who notices, oh, my hamstrings are very tight, you can use a strap or a rope behind the thigh here, and then you can pull the thigh towards you as you gently try to come up. Okay, so here and then gently coming up. Trying to straighten out that foot and the knee and bringing it towards your chest. And just holding here. Good. And then bending the knee to relax off that tension. Good. And you can straighten that leg again. Same thing, making sure you're not holding your breath. To stretch out the hamstring. This one is a really good one as well. Before we mentioned the piriformis, the sciatic nerve is in close proximity to that piriformis. Well, the sciatic nerve also runs along the back of the leg, so you can gently stretch that nerve as well, which is commonly associated with back pain. So this is a really good one for that, and relaxing off. And don't forget the symmetry, because now we're going to do the other side. So grabbing a hold of the thigh or using your sheet or towel to bring the leg back. And now kicking the leg up and bringing the leg up towards you. Good. And you don't have to pull the toes down. That's actually going to increase something called neural tension. So just leave the foot in a relaxed position, because I don't want you to start feeling like a numbness or tingling, not with this stretch. Okay, so we're just gently working on relaxing the muscle, and then the upper part of that sciatic nerve if we want, but we don't want too much tension down that leg. Good. And then relaxing off and gently coming back down. So now you have two variations of the piriformis stretch and also the hamstring stretch. So one seated, one laying down. There's one more stretch that we have to target with us laying down, and that is going to be our hip flexors. So specifically for the hip flexors, I'm going to show you a quadricep stretch, which will stretch out the front of the thighs and also the hips, because the quadricep crosses both the knee and the hip joint. So we want to make sure we're keeping flexibility along that muscle. So with this stretch, you can either do it on your side or on your stomach. If you're someone who has difficulty laying on your stomach, I encourage you to go on your side. Otherwise, you're welcome to try on your stomach, okay? So with this stretch, I'm going to show you on your stomach. You're going to lay down. If you need to use a strap around the foot, you can. But you're just going to use a strap or even just grabbing the foot and pulling the heel towards your bottom. Now with this stretch, you should feel it in the front of the thigh. And you may notice that you can't even get your thighs flat on the ground, because if you're super tight in the hips, your hips are going to pop up like this. So if this happens, then I just want you to gently work on trying to push your hips down using your muscles as you bend the knee, and then relaxing off of that. But trying to keep the hips down on the ground as you bend that knee. So that way now you can work on using the muscles to help you regain mobility. So squeezing the booty if you need to, and gently pulling the heel back, but trying to keep your hips flat on the ground. And that's if your hips are popping up. Now, if your hips aren't popping up and you're able to gently pull that knee, then you can squeeze the glutes again. So that way you get the hips closer to the ground. So squeezing those glutes and then gently pulling the foot towards your bottom until you feel a stretch in the front of the hip and the front of the thigh. And then you're just going to hold here, still breathing. Good. All right. And now we're going to do the opposite side. Remember, symmetry. So same thing before. If you need to just squeeze the bottom, that way you can bring the foot up and down as you try to keep the hips flat on the ground. That is okay, starting there, to keep the hips flat on the ground. And then you can progress to, if you're able to, grabbing the foot or even using a strap. So that way you are able to gently pull the foot towards your buttocks and gently squeezing the buttocks so the front of your hips will go down to the ground. And still breathing. Great. Very good. So now you have a variation of stretches that you can do to help with hip mobility. So that way you can work on decreasing your back pain. Because remember, lack of hip mobility is very common with back pain and actually can lead to back pain because your body is not able to move as well as what it should. So make sure you're taking the time to stretch. Give these various stretches a try and let me know how they work out for you.